Okay, class, let us continue our topic for anxiety disorders. For now, let's talk about phobia. Phobia, by definition, it came from the Greek word fear, which is a persistent and unreasonable fear of a particular object, activity, or situation. People with a phobia become fearful if they even think about the object or situation they dread, but they usually remain comfortable as long as they avoid it or thoughts about it. So, again, phobia, meron kang specific object na kinatatakutan. And they really have this unreasonable fear of the object that they are having phobia of. Pero, pag alam naman nila sa sarili nila na na-avoid na nila or naalis na nila sa paligid nila, they stop being worried or fearful. Most phobias technically fall under the category of specific phobias. In addition, there is a broader kind of phobia called agoraphobia, a fear of venturing into public places or situations where escape might be difficult if one were to become panicky or incapacitated. Katulad nga nung unang definition, sinasabi dito that someone can really reduce phobia if they think na wala na ito sa paligid nila. In agoraphobia naman, some of the people avoid places na masyadong matao kasi they are afraid na mahirap para sa kanila na escape or i-avoid yung mga situations na pwedeng mangyari. Specific phobia in DSM-5's label for an intense and persistent fear of a specific object or situation. Example nito. Sabi dito sa example natin. We got on board and then there was the takeoff. There it was again, that horrible feeling as we gathered speed. It was creeping over me again, that old feeling of panic. I kept seeing everyone as puppets, all strapped to their seats with no control over their destinies, me included. Every time the plane did a variation of speed or route, my heart would leap and I would hurriedly ask what was happening. When the plane started to lose height, I was terrified that we were about to crash. This is an example of phobia with taking an airplane ride class. Ito, ipinaliwanag niya lang kung ano yung nangyayari sa kanya kapag andun siya sa isang bagay na kinatatakutan niya. In this term, nakasakay siya doon sa eroplano which is kinatatakutan niya. There are 5 types class of specific phobias. Marked and disproportionate fear consistently triggered by specific objects or situations. The object or situation is avoided or else endured with intense anxiety. Katulad niyang kaninang example, kahit na meron siyang phobia in riding airplane, wala naman siyang magagawa kasi that's the only thing that would take him or her probably in his or her destination. So, kahit na ginawa niya, in return naman, yung intense anxiety, ramdam na ramdam niya all throughout the plane. Kung ano yung nakikita niya yung mga tao sa paligid niya para ng puppet, and yung keep worrying na baka bumagsak sila. Symptoms persist again for at least 6 months. Natural environment type. Ito na yung 5 types of specific phobias, including a fear of thunder and lightning. We call that astrophobia. Water, aquaphobia. Number 2, we got injury type na phobia. Fear of the dentist or injection. Ay nila baka, matakot sila baka masugatan sila. 3, animal type including dogs, snakes, and insects. Number 4, situational type including washing and enclosed spaces. And other types including choking, vomiting, or loud sounds. So these are the 5 types of specific phobias. Meron ba kayo? Pero again ang phobia, it should be present for at least 6 months. And yung physiological reaction natin is actually disproportionate or exaggerated. Yon, mga phobia. Next. In DSM-5 criteria for specific phobia diagnosis, basahin natin isa-isa. Again, you have the PDF file of this one class. Sinend ko kay Kelvin, or I think I posted it in our LMS account. A. Mark fear or anxiety about a specific object or situation. In children, the fear of anxiety may be expressed by crying, tantrums, freezing, or clinging. That is why nga the parents also educate themselves about the tone when their children are crying, kasi hindi naman ibig sabihin na nagka-cry yung mga children natin like they are hungry or they are disappointed. Probably daw this is also a symptoms of specific phobia. In other studies, sinasabi na yung pag-cry din daw ng bata is actually a symptoms of depression. So anyway, so susunod na yun. B. The phobic object or situation almost always provokes immediate fear or anxiety. No, by thinking about it, nanginginig ka na agad. C. The phobic object or situation is actively avoided or endured with intense fear or anxiety. D. The fear or anxiety is, again, out of proportion or exaggerated. E. The fear, anxiety to or avoidance is persistent, typically lasting for 6 months or more. F. The fear, anxiety, or avoidance causes clinically significant stress or impairment in social, occupational, other important areas of functioning. Again, you are dysfunctional already because of the fear. G. The disturbance is not better explained by the symptoms of another mental disorder, including fear, anxiety, and avoidance. Which means to say, your fear is not really because of the side effects of your other medical conditions or substances that you are taking. And specific phobia can be specified according to this code. Ayan. Sa ano yan, ICD, itong mga code na to, class. But anyway, so this is the DSM-5 take on the criteria for diagnosing specific phobia. And we have to know, class, that specific phobia has also comorbidity. Napag-usapan natin during our lecture 2 yung mga different concepts na kailangan nating intindihin when we goes on in our lectures about psychological disorders. Isa dun yung comorbidity. No, sometimes kasi yung mga disorder, it is existing alongside with other disorders. Parang nagsasabay sila. Or it could be a cause of one phobia to another, cause of one disorder to another disorder. So, ang comorbidity niya, specific phobia is rarely seen in medical clinical settings in the absence of other psychopathology and is more frequently seen in non-medical mental health settings. Specific phobias is frequently associated with a range of other disorders, especially depression in older adults. So, yun. Comorbidity ng specific phobia is actually depression. Nung hirap nun, may depression ka na, tapos meron ka pang phobia. It's just like because of your specific phobia, you keep thinking about these particular things, and then you are saddened by another things. Because of the early onset, specific phobia is typically the temporary primary disorder. Individuals with specific phobia are at increased risk for the development of other disorders, including other anxiety disorders, depressive and bipolar disorder, substance-related disorders, somatic symptoms and related disorders, and personality disorders. Why? Because just imagine if you have specific phobia, sa sobrang stress mo, you won't eat anymore. Baka magkaroon ka ng anorexia. Pwede ka rin magkaroon ng bipolar disorders because at one time when you think na you are out of danger, magiging masaya ka, and then on the other times, pag naisip mo na baka meron na namang lalabas na object na kinatatakutan mo, you get too afraid again. So anyway, these things could happen if you cannot manage, these symptoms of specific phobias. And another type, again, of specific phobia ng phobia, may dalawang type ang phobia. Number one is yung specific phobias na meron siyang 5 types class. And then this other one, the agoraphobia. Agora came from a Greek word agora, which means marketplace. It is anxiety about situations or those that are difficult to escape from, such as trains, bridges, or long trips. No, parang feeling mo kapag pumasok ka sa isang train sa sobrang dami ng tao, mahirapan kang lumabas kapag nagkaroon ng aksidente. Symptoms last at least 6 months. Example of an experience of a person with agoraphobia. For several months prior to her application for treatment, Veronica had been unable to leave her home. It is as if something dreadful would happen to me if I did not immediately go home. Even after she would return to the house, she would feel shaken inside and unable to speak to anyone or do anything for an hour or so. However, as long as she remained in her own home or garden, she was able to carry on her routine life without. No, it's just like hindi na lang ako lalabas ng bahay kasi I feel safer in my own house. Ayaw niya ng masyadong maraming tao. Ayaw niya ng mga strangers kasi hindi niya alam kung sino lalapitan niya when something went wrong. In DSM-5, this is the criteria for a agoraphobia diagnosis. A. Mark fear or anxiety about 2 or more of the following 5 situations. 1. Using public transportation. 2. Being in an open spaces. 3. Being in enclosed places. 4. Standing in line or being in a crowd. And 5. Being outside of the home alone. B. The individual fears or avoids these situations because of thoughts that escape might be difficult or help might not be available in the event of developing panic-like symptoms or other incapacitating or embarrassing symptoms. C. The agoraphobic situations almost always provoke fear or anxiety. D. The agoraphobic situations are actively avoided, require the presence of a companion, or are endured with intense fear of anxiety. Cannot really leave house alone. So mo lagi ka with someone who could actually know how to save you if something went wrong. E. The fear of anxiety is out of proportion to the actual danger posed by the agoraphobic situations to the socio-cultural context. F. The fear, anxiety, or avoidance is persistent, typically lasting for 6 months or more. G. The fear, anxiety, or avoidance causes clinically significant distress. Again, it's dysfunctional. H. Hindi ito result ng pagkakaroon mo ng other medical condition. And I. Hindi din ito symptoms ng another medical disorder or mental disorder rather. So that's agoraphobia. Agoraphobia comorbidity. The majority of individuals with agoraphobia also have other mental disorders. The most frequent additional diagnoses are other anxiety disorders like meron ka ding specific phobias kasi probably meron ka ding specific place or object na kinakakatakutan. Pwedeng hindi ka naman takot sumakay ng tren pero takot ka sumakay ng mga bus. Okay, panic disorder, kasi thinking nalalabas ka na naman, nagkakaroon ka na naman ng intense anxiety. Depressive disorder, whereas other anxiety frequently precede onset of agoraphobia. Tulad nito, class, yung SEPTANX or separation anxiety disorder. Probably nung bata ka, meron kang experience na lagi kang iniiwan ng mga parents mo. And dun nagsimula yung anxiety mo na hindi ka pwedeng lumabas mag-isa kasi may mangyayaring masama sa'yo kapag lumabas ka. Kaya, doon ka na lang sa loob ng bahay. Kasi nga, iniwan ka ng parents mo. And kapag bata ka, alam mo naman na mas safer ka kapag lumalabas ka when you are with your parents or when you are with adults. Ano pa? Specific phobias and panic disorder. Sometimes kasi yung mga phobia na to, natitrigger to ng ating mga unsolved anxiety during our childhood. Ayan, naiipon lang ng naiipon yan. Treatments for specific phobias. We got exposure treatments. Individuals are exposed to the objects or situations they dread. So it's just like fight, harapin mo kung ano yung kinatatakutan mo. May iba't iba tayong types of exposure treatments. We have desensitization, a technique developed by Joseph Wolk. Learn to relax while gradually facing the objects or situations they fear. When we say systematic desensitization, it is pakonti-konti mo ine-expose yung isang tao dun sa bagay na kinatatakutan nila. Pinakamagandang example nito is yung, for example, you have a fear of heights, o dun ka muna sa first floor, next, second floor, third floor, fourth floor, hanggang ma-manage mo yung anxiety na nararamdaman mo. And at the end of the day, malabanan mo siya. Yung flooding naman, the clients are forced to face their objects or situations without relaxation training and without a gradual build-up. So, kabaliktaran ito ng systematic desensitization. Yung flooding class, ito yung parang Carino brutal. O, takot ka sa aso, o, harap kita sa aso agad. Yan siya. Modeling. It is the therapist who confronts the feared object or situation while the fearful person observes. The behavioral therapists act as a model to demonstrate that the person's fear is groundless. Ito yung parang tignan mo ako gagawa. So, kapag nakita niya yung model, hindi natatakot dun sa bagay na kinatatakutan niya. So, maniniwala itong tao na to. At mawawala yung fear niya. For example, isang tao na takot sa aso. So, pwede, dun siya, nakaupo lang siya, mag-observe siya, while yung therapist, siya yung hahawakan niya yung aso, ilalagay niya sa lap niya, yayakapin niya, or ikikiss niya. So, by observing the behavior of the dog towards the therapist na hindi naman nasasaktan yung therapist or masaya naman sila, eventually the client will feel at ease again touching also the dog kasi hindi naman pala siya harmful according to his observation. Next up. Alright, class. Next up, we have the social anxiety disorder or the SAD. Social anxiety disorder is persistent, unrealistically intense fear of social situations. Paano to? Ano ang pinagkaiba nito kanina, class, dun sa agoraphobia? Dun sa agoraphobia kasi, takot sila sa social situations, not really because of the presence of the people they're in, but because takot sila na baka hindi sila maka-escape dahil nga sa dami ng tao. Pero, when we say social anxiety disorder, it involves being scrutinized by or even just exposed to unfamiliar people. Ayaw nila ng mga strangers. Ayaw nila yung feeling na they think that people are always looking at them. Mula ulo hanggang paa, ina-analyze their strengths, ina-analyze kung maganda ba sila, malinis ba sila, etc., etc. Fear. This is the exact difference of social anxiety disorder as compared with the agoraphobia. Fear of being negatively evaluated by or offensive to others. Symptoms persist for at least 6 months. Balik tayo, ayaw nila nang may masasabing masama sa kanila yung ibang tao. So, it's just parang cognitive functioning din na, again, we cannot please anybody. But people with social anxiety disorder really tends to have a very low self-esteem and self-worth. Kaya instead, ayaw na lang nilang makipag-mingle or makipag-interact sa ibang tao. What causes social anxiety disorder? They hold unrealistically high social standards and so believe that they must perform perfectly in social situations. Most people, class, with social anxiety disorder are very hard on themselves. Okay? They feel na hindi sila worthy as a person. Even though the people around them keep on telling their positive sides, it's hard for them to believe that those are true. Kasi nga, they feel that they should be perfect because that is how the society wanted to be. They view themselves as unattractive social beings. They view themselves as socially unskilled and inadequate. They believe they are always in danger of behaving incompetently in social situations, and they believe that inept behaviors in social situations will inevitably lead to terrible consequences, and they believe that they have no control over feelings of anxiety that emerge during social situations. I, class, for myself, really thought I have this social anxiety disorder because I'm really hard on myself. These things are what I have experienced during my high school to college years. So I kept on doing things perfectly na at the end of the time, it's not really giving me a very good output kasi sa sobrang perfectionist, in the end, hindi mo na natatapos. And class, whatever you do talaga, people are going to give you some comments and reactions towards it because in a way, meron tayo iba-ibang perspective. Treatment for social anxiety disorder. Some people are taking in antidepressant medications that seem to be the drugs of most help for this disorder, often more helpful than benzodiazepines or other kinds of anti-anxiety medications. Yan, because they cannot control themselves into thinking negative things. Exposure therapies encourage clients with social fears to expose themselves to the dreaded social situations to be remain until their fears subside. This is what happens to me. Really, I hate people or hate being looked at. So I have decided to take up psychology. So I expose myself more and then become a teacher. Cognitive therapies, they have this what they call the rational emotive behavior therapy or the REBT. This is a short-term form of psychotherapy that helps you identify self-defeating thoughts and feelings, challenge the rationality of those feelings, and replace them with healthier, more productive beliefs. Most of the time, ang pinaka effective talaga to deal with social anxiety disorders and or other disorder kapag nagka-counseling ka is the REBT. Now, in here, the counselors are going to ask you, what is your problem? What do you think is the cause of the problem? What did you do in order to fight that problem? And what more can you do if the same problem arises? It's just like you're guiding the client to identify and then to resolve their own difficulties or problems. Pinapa-picture out nila sa inyo kung ano yung mangyayari. And at the end of the day, ikaw din ang makaka-realize what can you do about it. Next is the social skills training, yan, modeling, parang dun sa anxiety or specific OVIA. Role play, rehearsing is kapag ganito yung nangyari, ganito yung gagawin mo, okay? I-roleplay naman natin. Halimbawa, ito na yung nakakatakot na situations. Anong gagawin mo kapag sobrang pinagpapawisan ka na, okay? Magbilang ka ng 1 to 10. So, rehearsing, feedback, and then reinforce that behavior. When we say reinforce that behavior, ibig sabihin, kapag nagawa nila ng tama yung isang bagay, bigyan mo ng reward. Ganun yung nangyayari sa social skills training. Okay? It's actually a step. Una, kung ikaw yung counselor, ganito gagawin mo kapag ikaw ay natatakot na mag-recite sa harapan ng maraming tao, ipapakita ko sa iyo, ganito. Roleplay. After mong i-model, hayaan mo naman yung client mo, yung gumawa. Okay, nang ginawa mo. And that is, kapag yung roleplay, pinaulit mo ng pinaulit, that is called rehearsing. And then, after niyang gawin, as a counselor, sabihin mo sa kanya kung ano yung mga tama mong ginawa at saka kung ano pa yung dapat i-improve. Reinforce, rewardan mo siya kapag may ginawa siyang tama. So, here are some famous people with their famous fears. For example, si Adele, Seagulls. We don't know if this is true or if they are diagnosed. Rihanna, fish, Justin Bieber, elevators, enclosed places. So, probably meron siyang agoraphobia, si Justin Bieber. Aretha Franklin, air travel. Kristen Stewart, public speaking. It makes sense. Johnny Depp, clowns, spiders, and ghosts. I, myself, has fear of clowns as well. I don't really go to party with clowns. Jennifer Aniston, air travel. Justin Timberlake, snakes. Keanu Reeves, darkness. Scarlett Johansson, cockroaches. Well, most of the girls. Miley Cyrus, spiders. Nicole Kidman, butterflies. Madonna is thunder. Once again, class, again, eto ay famous fears, hindi pa naman sinabing phobias. The DSM criteria for a social anxiety diagnosis are as follows. Fear or anxiety specific to social settings in which a person feels noticed, observed, or scrutinized. In adult, this could include a first date, a job interview, meeting someone for the first time, delivering an oral presentation, or speaking in a class or meeting. So you could see, class, if you have social anxiety disorder, it could actually blocking your potentials into becoming an awesome person that you can be. Pwedeng makapag-date ka ng isang babaeng gustong-gusto mo, but because takot ka with the negative evaluations, aatras ka na lang. And the same with your job interview. Yung mga tao, they thought na they cannot apply in a very good company because they have a negative evaluation of themselves. Just without trying, they lose already. Natalo na sila. In children, the phobic avoidant behaviors must occur in settings with peers rather than adult interactions and will be expressed in terms of age-appropriate distress such as screaming, crying, or otherwise displaying obvious fear or discomfort. One distinct characteristic of social anxiety disorder, class, is that you are afraid of negative evaluation, especially with people which has the same characteristic as you. For example, parehas kayo ng age katulad nga dito kapag bata, syempre sa mga peers nila, ano pakialam nila sa matatanda? And mostly sa mga adults, halimbawa sa kapwa nila HR practitioner, sa kapwa nila psychology students. So ang main feature is negative evaluations from the people that they have similar characteristics. Typically, the individual will fear that they will display their anxiety and experience social rejection. Ito na yun, yung parang panic attack, na wala pa man din nangyayari, natatakot ka na. 2. Social interaction will consistently provoke distress. Sipin mo pa lang na makikipag-usap ka with anyone, stress ka na. Social interactions are either avoided or painfully and reluctantly endured. The fear and anxiety will be grossly disproportionate to the actual situation. Again, comparing agoraphobia and social anxiety disorder, agoraphobia avoid public places because they are afraid that they cannot escape, whilst social anxiety disorder, they avoid public places because they are afraid of interaction with other people that could negatively evaluated them. The fear, anxiety, or other distress around social situations will persist for 6 months or longer and cause personal distress and impairment of functioning in one or more domains, such as interpersonal or occupational functioning. The fear or anxiety cannot be attributed to a medical disorder, substance use, or adverse medication effects. Again, kailangan ang symptoms ay hindi dahil sa another medical conditions or substance abuses, other mental disorder, and if another medical condition is present which may cause the individual to be excessively self-conscious, Example, prominent facial scar, the fear and anxiety are either unrelated or disproportionate. The clinician may also include the specifier that the social anxiety is performance situation specific. Some social anxiety disorder are just specific for a particular situations, hindi naman lahat. For example, yung nangyari sa akin, afraid lang ako when in front of everyone. Yung iba naman, nagkakaroon ng social anxiety disorder kapag makikipag-date or kapag mag-a-apply ng trabaho. Hindi naman lahat yon ay nag-a-apply sa kanya. So, we could just specify. Selective, kumbaga. Onset. Kailan ito nagsisimula? According to the DSM-5, the median age of onset of social anxiety disorder in the United States is age 13, with 75% of those with social anxiety disorder experiencing the onset at a range of ages 8 to 15. So when say onset, kailan nagsisimula? The onset can be insidious or sudden, triggered by specific event. Comorbidity occurs with other anxiety disorders. Depression naman. It seems that most of the anxiety disorders comorbid with depression. They are blocking themselves to do something because of worriness. That's why they tend to get depressed.